If you sometimes feel your feet tingling at night, or your hands go numb for no obvious reason, or you experience burning, stabbing, or electric-like sensations, it's easy to feel frustrated or worried. These sensations are not always signs of inevitable aging. Often, there are underlying factors that can be addressed. Understanding how nerves function, what can affect them, and how to support them can make a huge difference in daily comfort and long-term independence. How nerve problems begin. Nerves are living tissue, not wires. They need a steady supply of oxygen, nutrients, and stable internal chemistry to function properly. Unlike skin or muscle, nerves heal very slowly. That means subtle damage can accumulate quietly over time, long before noticeable symptoms appear. Tingling, numbness, burning, and pain are often late signs of nerve stress. Many seniors are surprised to learn that small, repeated factors in their daily lives may be contributing to nerve discomfort long before obvious symptoms arise. Common misconceptions about nerve health. A lot of people are told that nerve issues are simply a result of aging or genetics. While age and family history can play a role, they are rarely the sole cause. For many seniors, the real drivers are everyday habits, diet, and nutrient intake. Neuropathy and nerve discomfort develop gradually, often without anyone noticing until the problem becomes significant. Recognizing this early is key to slowing or preventing further nerve stress. The role of blood sugar in nerve health. One factor that often surprises people is blood sugar. High blood sugar isn't just a concern for people with diabetes. Even occasional spikes can create stress on nerves, particularly the long nerves in the hands and feet. Repeated spikes can contribute to inflammation, oxidative stress, and subtle damage to the protective coating around nerves. Over time, this may lead to tingling, numbness, burning sensations, or imbalance. Many seniors experience these spikes without realizing it, especially if they are pre-diabetic or have borderline blood sugar levels. Understanding blood sugar's role is essential for protecting nerves over the long term. Recognizing early signs. Early signs of nerve stress are often mild and easy to overlook. Tingling, occasional numbness, or burning sensations can feel minor, but are important signals. Sometimes these symptoms are dismissed as just getting older. In reality, these signals are a chance to make small changes that may prevent more serious issues later. Early awareness allows for adjustments in diet, activity, and nutrient intake, which can protect nerves before significant damage occurs. How nerve damage develops gradually. Nerve stress is usually gradual. Every time blood sugar rises sharply, the nerves are exposed to chemical stress. Tiny blood vessels that supply oxygen to nerves may be affected over time, reducing the support nerves need. Nerve discomfort doesn't usually appear suddenly. It develops in stages. At first, you may notice mild tingling or occasional numbness. Later, more pronounced sensations like burning or sharp discomfort can emerge. Understanding this progression helps us focus on prevention and early intervention. Common daily habits that affect nerves. Certain daily habits can contribute to nerve stress without being obvious. Liquid sugar, for example, is absorbed quickly and can spike blood sugar, especially if consumed on an empty stomach. Sweetened drinks, fruit juices, and some smoothies are examples. Refined carbohydrates eaten alone, such as white bread, cereal, crackers, and pasta, can also contribute. Even when these foods feel healthy or easy to digest, they may raise blood sugar faster than the body can handle. Additionally, frequent snacking throughout the day can prevent blood sugar from stabilizing, leaving nerves under continual stress. Medications and nutrient balance. Some medications can influence nerve health indirectly by affecting nutrient absorption. Certain acid-blocking medications, diabetes treatments, or cholesterol medications may reduce levels of vitamin B12 over time. B12 is crucial for nerve protection. Deficiencies can make nerves more fragile, which may lead to misfiring or discomfort. Regular checkups and blood tests can help identify and address deficiencies before they contribute to worsening symptoms. Understanding the tipping point nerve damage has a tipping point. Mild early stress may cause minor tingling, but once nerves reach a threshold of stress, symptoms may accelerate. Not all seniors with high blood sugar develop nerve discomfort, and this depends on exposure frequency, duration, and individual nerve resilience. The good news is that addressing stressors early can slow or stop progression, often improving comfort and maintaining independence. Stabilizing blood sugar for nerve health. The first step to protecting nerves is stabilizing blood sugar. This doesn't mean striving for perfection or strict dieting. Instead, it means keeping blood sugar relatively steady to reduce stress on nerves. One practical approach is pairing carbohydrates with protein or healthy fats. Eating carbs alone, whether fruit, bread, or cereal, can spike blood sugar quickly. When eaten alongside protein or fats, sugar is absorbed more slowly, reducing nerve stress. Small adjustments in meal composition can have a meaningful impact over time. Avoiding liquid sugar. Liquid sugar, found in sweetened beverages, fruit juices, and some smoothies, is absorbed rapidly and can spike blood sugar quickly. Even juices labeled as 100% natural are concentrated sources of sugar without fiber, which normally slows absorption. Choosing whole fruit instead of juice and eating it after a balanced meal can protect nerves while still allowing enjoyment of natural flavors. Simple changes like this reduce spikes and promote nerve comfort. Nutrient support for nerve health. Certain nutrients support healthy nerves. Vitamin B12 maintains the protective coating around nerves, called myelin, which helps signals travel efficiently. Magnesium supports proper nerve signaling and can reduce cramps or twitching. Folate works with B12 to maintain nerve function. Alpha-lipoic acid may help reduce oxidative stress in nerves and support overall comfort. These nutrients are not miracle cures, but they help stabilize nerves and protect existing function. Blood tests and professional guidance ensure safe supplementation and avoid excessive doses that could be harmful. Reducing inflammation. Chronic inflammation can amplify nerve discomfort. Highly processed foods, refined oils, and excess sugar may increase inflammation. On the other hand, foods like vegetables, fatty fish, olive oil, and spices such as turmeric help calm inflammatory pathways. Reducing inflammation supports nerve health by minimizing unnecessary irritation and creating a more stable environment for nerve tissue. Gentle movement for nerve support movement is critical for nerve health, but it doesn't need to be intense. Gentle activity, especially walking after meals, supports circulation and helps regulate blood sugar. Even 10 minutes can improve blood flow to nerves, enhancing oxygen and nutrient delivery. This kind of movement complements dietary changes and nutrient support, creating an environment where nerves are better protected and supported. Reframing expectations about nerve recovery. Nerves regenerate slowly, and some damage may not fully reverse. However, slowing progression, reducing discomfort, and maintaining independence are highly valuable outcomes. Early changes can improve sleep, balance, and day-to-day confidence. Recognizing that even small improvements are meaningful helps seniors stay motivated and engaged in self-care. Early intervention preserves independence. Neuropathy isn't just about discomfort, it's about independence. When nerves are stressed, balance and coordination can decline, increasing the risk of falls. Early intervention, stabilizing blood sugar, improving nutrition, reducing inflammation, and supporting circulation can preserve mobility, confidence, and safety. Small, consistent changes can prevent progression and help maintain quality of life for years to come. Practical steps to take today. Here are simple, practical strategies to support nerve health over the next few weeks. 1. Remove liquid sugar. Avoid juices, sweetened beverages, and sugary smoothies. Opt for water, herbal tea, or whole fruit after meals. 2. Pair carbohydrates with protein or healthy fats. This slows sugar absorption and reduces nerve stress. 3. Eat fruit after meals in small portions. Whole fruit provides fiber and nutrients without sharp sugar spikes. 4. Incorporate gentle movement. A 10-minute walk after meals improves circulation and helps regulate blood sugar. 5. Check nutrient levels. Ask your healthcare provider to review vitamin B12, magnesium, and folate levels, especially if you take medications that may affect absorption. Pay attention to how your body responds. Many seniors notice improved comfort, steadier balance, and more consistent energy within a few weeks. Managing expectations. It's important to understand that nerve health doesn't change overnight. No single adjustment or supplement is a miracle cure. Protecting and supporting nerves is a gradual process that builds over weeks, months, and years of consistent care. The goal isn't perfection, it's steady improvement and stability. Even small, positive changes, like pairing carbohydrates with protein, reducing liquid sugar, or adding a short post-meal walk, can make a meaningful difference. These small steps slow the progression of nerve stress, reduce discomfort, and help maintain independence. Over time, the effects compound. Consistency matters far more than dramatic short-term interventions. Avoiding common misbeliefs. Many seniors feel discouraged because they've been told nerve issues are inevitable or untreatable. That mindset itself can become a barrier. While some nerve damage may not fully reverse, much of the discomfort caused by early nerve stress can be slowed, reduced, or managed effectively. Awareness is the first step. Recognizing early signs, making small daily adjustments, and seeking guidance when needed can lead to noticeable improvements in comfort, balance, and energy. Understanding that progress is possible, even if gradual, can be motivating and empowering. Supporting overall well-being. Healthy nerves thrive in a supportive environment. Lifestyle factors play a huge role alongside targeted strategies. Balanced meals, proper hydration, moderate exercise, and nutrient-rich foods all contribute to nerve function. Nutrients such as vitamin B12, magnesium, and folate are particularly important for maintaining nerve structure and signaling. Beyond diet, stress management, adequate sleep, and gentle activity support the body's natural repair processes and reduce nerve irritation. By fostering an overall healthy lifestyle, seniors can create conditions in which nerves are better protected, symptoms are minimized, and quality of life is maintained. Looking ahead, early nerve stress, tingling, mild numbness, or occasional burning is a signal, not a verdict. These sensations are an opportunity to make meaningful changes before problems become more severe. Adjusting diet, supporting nutrient intake, avoiding rapid blood sugar spikes, and maintaining gentle movement are all steps that can protect nerves over time. Seniors who take action early often experience improved mobility, steadier balance, less discomfort, and greater independence. The earlier these habits are adopted, the more impact they have on long-term nerve health and overall well-being. Final thoughts. Nerve health is not a hopeless journey. Understanding the subtle factors that contribute to discomfort empowers seniors to take control. Early awareness, small adjustments, and consistent supportive habits can stabilize nerves, reduce discomfort, and preserve independence. Even modest improvements are meaningful. They signal that nerves are being cared for and that progression can be slowed. The key is to start today. Pay attention to your body, implement small changes, and build habits that protect nerves over time. These consistent, practical choices lay the foundation for greater comfort, mobility, confidence, and quality of life in everyday activities.